So I will repeat. Thank you very much for being here. It's a pleasure to welcome you to this new episode of the Aesthetics series. Sorry for that delay with the sound. It's a pleasure to see that more and more of you are taking part in our webinars, and on behalf of Bioscience and all its staff, we would like to thank you very, very much for this. I hope you're safe at home, starting to see the light at the end of the tunnel. For some of you, hopefully we'll all get out of this tough situation gradually. Today we have a great program since it's Dr. Piero Travai who is with us to talk about his experience, about Piero, in the correction of liposuction using hyaluronic acid fillers. As you're used it to now, you can already send us all your questions through the small dialog box you have on your screen, and there where you can write your questions. As always, we'll try to answer as much demand as possible. In case we don't have the time, we'll take care to answer each of you by email or during the next webinars proposed by Bioscience. As you already know, Bioscience is today the only manufacturer of hyaluronic acid fillers in the world with a CE mark on all its products, not only for the face, but also for the body. It's because we control all stages of the life of our products, from production to sales, that we can offer your patients the best solutions in terms of hyaluronic acid fillers. Today we'll talk about Iacorp. Iacorp is our range of long-lasting dermal fillers designed for face and body to obtain perfect results in face contouring, rejuvenation, and body augmentation. Iacorp's formula concentrates on defined particle size and relevant concentration of hyaluronic acid, which increases the duration and ensures the viscoelasticity of the gel. I guess Dr. Travai will talk about this, but we'll focus today on lipocorrections with our host, Dr. Piero Travai. He's a true expert on that. For those who don't meet, or for those who haven't met him yet, Piero Travai is a highly experienced board-certified plastic surgeon who has graduated in plastic and reconstructive surgery from the University of Milan in Italy. With more than 20 years of experience in every branch of plastic and aesthetic surgery, Dr. Travai is a specialist in facial and breast aesthetic reconstruction. Since 2014, he's been certified plastic surgery specialist, and he's working in Champs-Élysées Aesthetical Medical Clinic in Dubai. And in the last 10 years, Piero Travai has been the main researcher and international speaker of Italian and international companies for aesthetic, chemical, electromedical, and laser products. Obviously, and we're proud of that, he's also a member of Bioscience Scientific Committee. Dr. Travai, I leave you the surgery room.
Hi, hello. Thank you to introduce me. Okay, today I think we will talk about an interesting argument that is macromolecular hyaluronic acid to use the reconstructive, to use in liposuction connection. And this is a very interesting issue that maybe can be used from all of the people, dermatologists, plastic surgeon, and aesthetic doctors. This is the agenda. We will talk before a liposuction procedure, then the defects that can happen after the liposuction, how to correct the liposuction in classical ways, and we will give you some suggestion how to correct with a macromolecular hyaluronic acid that is Iacorp, the technique, and I will show you the result, and then we will go through the conclusions. And liposuction, as you know, is the signature procedure of a plastic surgery. Is the one the procedure that is giving to the plastic surgeon more evidence and give more people to make people more identify the plastic surgery. And actually, the plastic surgery liposuction is the second most performed cosmetic surgery. And this is underestimated because, as you know, the liposuction is not only done in general anesthesia, but is even done in local anesthesia. So the data that we can see, that is in 2018, maybe is showing less of the procedure. And as you know, the liposuction can be done in the 3 typical way. Is a suction assisted liposuction, that is the most common one. Then the ultrasound assisted liposuction with all the variation like Vaser and other, and power assisted liposuction. Both of those techniques are in fact reducing the amount of fat in the body to obtain to have a good shape. But it's liposuction, despite what is thinking a lot of people, a lot of doctors, is not just a procedure that is using a vacuum and is pulling out an amount of fat, but is a surgery that requires skill and long training and a very keen eyes for details, because it's very important to have a smooth and a very good result, and to reshape the body in very natural ways. So Pierre Fournier, that was the beginner of this technique, used to say that it's not the fat that is removed, but the fat that remains after liposuction that determines success. But unfortunately, people that is doing this kind of surgery is not very skilled. Not all are very skilled, and it's possible to see in our clinic, in our office, some uneven result. And these are results that coming from botched liposuction, like the one that you see on the left, on the right side, that leave the patient feeling more self-conscious about the area of the body that the surgeon or the surgeons try to improve in the first place. Then there are more, there's a big psychological aspect especially in the patient that had this kind of uneven and not good result, that are very concerning about the result, and they feel anxiety and worry, and want to find other option to correct this defects of the skin and of the fat. And mainly the irregularities and depression are frequent after this kind of surgeries. And this is coming because the surgeon that performed was not careful to the details and was not careful to remove in the right way, in the right plane, the amount of fat. The botched liposuction markings, the one that you can see, usually consist on sagging skin, uneven areas, not smooth texture of the skin, some irregularities, and this skin discoloration. These are mainly coming because of some wrong procedure, especially when you remove an excessive amount of fat in the same place, like you see on the right side. The surgeon that performed that surgery removed a lot of trochanteric region, creating the 2 very deep folds, and this is called the focal excessive removal. Then is another kind of mistake, that is a superficial removal, when the visible damage is determined by the injury of the superficial blood and lymphatic vessel and superficial fat. The superficial liposuction is very good, but should be performed with the small cannulas and in a very smooth way. And sometimes we have, especially now, we see that is going on fashion, the recreate the 6-pack and recreate with a Vaser and other more aggressive liposuction to recreate a skinny and reduce the fat and create a skinny body. to have a full thickness necrosis, like you see in the right side, with no evidence of subcutaneous tissue, with an even removal of the fat on the gluteal area, with some area with the necrosis where the patient had infection. And the result is a big adherence of the tissues from the deep to the superficial. Then we go through the liposuction correction. We have the classical technique and the surgical that consists on the fat grafting and the lipo revision. And then there are not surgical techniques, that is macromolecular, that I want to today I want to be focused on this more, macromolecular hyaluronic acid, and then the power assisted device that are some other that we will not mention today, that are consisting in cryolysis and other machine with use power, not interested today in our discussion. The fat grafting is the best technique that we can use when it's the most effective for the volume replacement in all the body. But we have to consider that we should have a good donor side, and we have to consider even the resorption of the fat, that in a year maybe can be the 50–60% of the fat that we insert in that area. And the fat grafting, we have to consider that it is a surgical technique. It's not possible to do without a high state of sterility. We need an operating room. We need several passages for purification that should be in sterility. And especially in the wide areas, when you treat wide areas, the risk of thromboembolism is really high. And not to forget, there is a risk of infection. This is a case that happened after a huge insertion of liposuction to have a BB Brazilian butt lift, and that correctly was performed without any sterility. This technique has a very good benefit cost, that the ratio of the resorption, as I told you, is very high, and after 1 year, the best situation, the 30–40%, even 60% get lost, depends on the lifestyle of the patient. There is another way, there's a lipo revision, that is a combination of liposuction, fat transfer to remove displayed fat cells and fill hollow areas or uneven grooves. We have to consider in this case that we have the same risk, and we have to perform again the same procedure, and sometimes we not need just one procedure, but we need to have several. We do 2–3 times to have a good result. And of course, this one, it requires an operating room, a downtime, and it's very expensive for the patient. Moreover, this technique requires high skill and keen eyes, because sometimes we have to do adjustment for the patient, and we have to treat again. And this one makes the patient become more anxious. And always, I've seen the patient that you suggest this and you treat in this case are not always happy. In this case, we see how I treated with the combining liposuction and fat grafting. I correct an uneven and some mistake done from another surgeon with those combined techniques. But what we have to think, and when we are looking at a patient that has a skinny constitution of excess of fat removal in all the body, in those two cases, as you've seen, it's not possible to have a donor side and enough fat. So it's very difficult to correct, in this case, the effects, the wrong and the mistakes, and the hollow and the saggy skin with the fat. So that we are considering the hyaluronic acid. The hyaluronic acid is not the one that we use for the body, is mainly the one that is macromolecular, so that has large particles that are from 250 from 500 nanometers that are more resistant to their volume. The smaller one is the one that we use for the face, that are going from 40 to 70 nanometer and are absorbed fast, so they're not good to use for this purpose. HiaCorp provide some products for the body and for the face, how said before Matteo, that for the face, face, lips, and volume face, and the other one is for the body, that is HiaCorp MLF1 and MLF2. The difference between those two is the width of the particle, where the MLF1 is composed mainly of small particles, and MLF2 from bigger particles. What is the difference from two? That MLF1 has less elasticity and more viscosity, and the cohesivity increase with increasing of the particle. So it will be more useful for our purposes to use HiaCorp MLF2 when we want to replace a lot of volume, but when we would like to reconstruct more the subcutaneous tissue and surface, should be more useful than MLF1. The safety and accuracy is very important for any kind of product of hyaluronic acid. And just to remind for people that was not on a webinar, they didn't attend the webinar of Dr. Brambilla, that was very interesting, the first one. It's very important to know that elasticity, viscosity, and cohesivity are the three main characteristics important when you decide to use hyaluronic acid. The elasticity is related to recover the original shape, and the viscosity is how the spread and it diffuse in the tissue, and is related to an ability to exactly the opposite, to recover the original shape. And the cohesivity is determined by concentration and the strength of hyaluronic acid and the degree of cross-linking. It's very important to know that HiaCorp developed the advanced taxotropic technology that especially designed gel property that become less viscous under pressure. Doesn't mean that when you use even this macromolecular hyaluronic acid, while you're putting the pressure on a syringe, it looks very soft and very easy to inject, and immediately it returns the original viscosity under the pressure when after that is in the body. Does it mean that it's spreading and it's not having the problem of other hyaluronic acid of migration? So the technique that we now today we are showing is basically that's the simplest one, and the one that I'm using when I'm facing the problem of the deformities after liposuction. First of all, I make the patient standing and I mark the area to be treated, and detecting the areas that has to be augmented, so we have to put more filler, and the surrounding convexities. And I mark this with a permanent marker, and I take a picture. After I apply a very very good disinfection of the area with betadine or antiseptic solution. Then it's important how to inject, because in the entry point where I will place the injection, I will inject some lidocaine. Usually I inject only this area not to feel the pain, the patient feel pain while I'm inserting the needle and the cannula after. But sometimes I do inject, I make a slightly injection of the area that should be treated. Slightly, it means that I don't exceed of 1-2 cc every 10 square centimeter of lidocaine. And then I use a thin sharp needle to inject in the place where I before treated with the lidocaine, and I reach the area with 100 millimeters blunt cannula. And as I told you, I don't use too much. I don't use infiltration, because infiltration of the area can modify the shape of the defects, and after can develop a migration of the product, because it will be diluted and will be not so active. And the technique I'm showing is how I will explain. Okay, here I'm going to injecting on surface in those two cavities created by the cannula. I'm injecting MLF1 superficially and retrograde to recreate a subcutaneous tissue. As you see on the opposite side, there is adhesion of the tissue, superficial tissue, to the deep tissue. Then I spread and I massage the product. I feel that I don't have any lump, and I pinch to feel that it's well distributed on the subcutaneous tissue superficially. As you see, the quality of the result is very good, and I think I'm thinking to have a 4D dimension of the treatment, because not only the volume and the shape, but even the sensation for the patient is the same of the tissue that the recovered one is the same of the normal tissue. And it's very important to spread, especially when I'm working superficially. And this is the final result. And have to go. Okay, so this one is another way to do the superficial treatment. I do the subcision of the areas that are have fibrotic response after the liposuction, and then I inject more superficially with the cannula. Same I'm doing in all the places, and the green one marked area I treated before with MLF2 to have more volume. In this case, when I'm treating superficial tissue, I'm treating them with MLF1. And now inserting the camera. Okay, so now I show you some results of this technique. That gave me an improvement of the quality of the skin, and especially after few months, there is improvement of the skin. When it's hydrated, it will be recovered and will be more hydrated. because as you know, hyaluronic acid is really giving more hydration to the skin because it's recalling water. Improvement of the thickness of the subcutaneous tissues because of the MLF1 and MLF2 are macromolecular and are recalling a lot of water and recalling a lot of filling all the space and with their expansion in the tissues, and neovascularization of the area, because you will see that all the area all around that usually is a suffering is a dark spots as a brown, it becomes pink and becomes natural. And I show you here some before and after. In the left side, the picture that I showed you before had a focal local aspiration of fat, and in this case is very difficult to treat because the area, it has been the result has been a very thick fibrotic tissue. And after a couple of treatments, this is a result that I reached. It's not perfect, of course, but it was not possible to take any more fat from other part of the body. And the only thing was possible to do is just to inject the hyaluronic acid macromolecular. I use here MLF1 on surface and MLF2 in the depth. This is another case that she had a Brazilian butt lift and she had an infection, and the place where she put the tattoo, or the place that the surgeons used to drain the infection, and the result was coming, the result of the hollow are coming from the loss of the fat and the infection itself. And after the treatment, you see how it's been very nice, the shape and the recovery of the skin and the quality of the superficial tissues. And this is another case that she had a very aggressive liposuction in a gluteal area. She didn't want to have any other liposuction. And after more treatment, here I did 4 treatment of MLF2 because we need to have more volume on both sides. I reconstitute the volume of the butt, and I gave more, as you see, on even the quality of skin, I recovered the quality of the skin. This is another case, and it is showing an immediate result after a treatment, how it changed, and it's possible to see immediately from the patient. And the patient after the treatment, always she's 100% happy, because first of all, the patient did this one without undergo another surgery. Then she sees the difference, and she sees that it's possible with the other treatment to have more result. And you see that it's not aggressive, and it is not so much heavy for the patient itself. This is another case of an even liposuction, left side and right side. After the treatment, she recovered completely the shape with MLF1 treatment. And this is this case that I showed you before. This girl, she went to do a liposuction with a hard, heavy removal, and they tried, she was skinny, and in any case, they took all the fat in the body and they did a Brazilian butt lift, and they put it in the buttock, and the result, it has been a huge infection of the area with infection of the area with that's been treated 4 months with antibiotic and drain. You see the whole of the drains. And in that case, I used more than 3 treatments to reach this result. It is still under treatment, and I used in each side 3 treatment of MLF1, 5 each treatment 5 injections, so 50 ml each side. Doesn't mean that she has actually 150 each side ml of MLF1 in the body. So at the end, when we think about macromolecular hyaluronic acid, and we think surgery and fat grafting, we have to consider several things. The first one, of course, the cost benefits are higher in terms of the cost of injection and to reach the final result. So the fat grafting is less expensive if you are sure that in only one time you can recover the situation, you can have an improvement. But at the same time, we have the risk of infection and the complications that are very high in surgical procedure. Then we have considered the reabsorption, that the reabsorption is always present, and always we have reabsorption of the fat after we put, especially because the areas in which we are injecting the fat are damaged areas, are areas in which the vascularity is not good, and same the fat that we insert is not having a good nourishment. Then, in conclusion, what I'm thinking, my message is that with macromolecular hyaluronic acid with higher curve, we have the accuracy of the treatment, because we can treat exactly in the place and exactly at the level that we want, and with the right substance, the defects. Then we do, this is important, we do a treatment in local anesthesia, and it's possible to do with all the precautions, of course, all the precautions we can do in our clinic or in sterility, but it's in local anesthesia or without a full anesthesia and without undergo another procedure. And there is a low risk of infection, because the fat is more risky and gives, as we have seen and everybody seen in the practice, can give more infection. And then there is a slow reabsorption. There is a slow reabsorption because I've seen in my experience that now are more than 3 years that I'm treating a lot of patients in this way. The reabsorption is very low, because as I told you before, the vascularity is not so much developed in a place where they are treated and where you had the scar from the scar and the adherence of the tissue. And because of that, you have less vascularity and less reabsorption of the hyaluronic acid. Then this is a repeatable treatment. Repeatable treatment, does it mean that the patient always can come back to your office, to your clinic, and have again another treatment, and to be always to have always a good result, and to keep the result for a long time? This is why I'm thinking that hyaluronic acid treatment, macromolecular hyaluronic acid treatment for the liposuction defects is a real new frontier, and I suggest you, if you didn't try it yet, to try this kind of procedure, because it will be successful even in your hands. Thank you so much, and I'm ready for your question.
Thank you very much, Dr. Krabai. We have a lot of questions about the quantity, so the quantity of product. So in order to summarize the question, I'd like to ask you first, what is the quantity usually required for this indication? That's a question we had from Dr. Rivera from Peru. So what is the quantity of product for that indication, and what is the maximum amount to inject as a first procedure?
Okay, the amount, it's obvious that depends on the area that has to be treated. There is a limit that it comes from the amount, because you have to use a 5-6 syringe, that means 50-60 ml of hyaluronic acid in the worst and largest cases. Not too much, because if you put too much, it's not will not keep inside the tissue, and maybe they can, because the heavy can be subject to emigration. And always I'm using 5-6 injection every time in large areas. Then I call the patient to come again after a couple of weeks, 2-3 weeks, and just observe how is the situation. I use MLF1, as I told you before, for recovery, to recover the superficial damages, the superficial irregularities, because it's a softer, and it gives more. It doesn't give. It doesn't record too much water, so it's possible to control much better than MLF2. MLF2 is possible to use when you have very in large areas that you want to recover, and the volume, maybe the volume to recover.
Okay, thank you very much, Doctor. Because we have a lot of questions about the duration. What is the duration of that product? I will answer that. It lasts up to 2 years, so that's important for all of the doctors who wanted to know about the duration. True. We have a question from France, from Dr. Lorenz. Can HiaCorp treat cellulite?
But yeah, and cellulite, okay, cellulites is not, can be treated. It can be treated, the dimple of cellulites with subcision. Yeah, I try, in several cases I treated in this way. Yeah, I had a good result. It's possible to have a very good result. You practice the subcision and you insert MLF1 superficially with the cannula.
Okay, another question I will answer on the behalf of Bioscience. People is asking if we have any clinical studies and CE mark on this indication. Yes, we do. We do have CE mark on all HiaCorp products, and we will have a clinical study published in mid of 2021. So yes, we have the CE, and yes, we're working on the 1-year follow-up clinical study that will be published next year. From Dr. Agapoulos from Greece, how many times you are treating a patient for liposuction defects, Dr. Krabai? Is that something that you treat a lot?
How many times? Okay, usually I treat for 2-3 times minimum, because the first time the people that is coming usually has a lot of defects and a lot of problem, because the mistakes are not only concentrated in one part. When you do a botched liposuction, you have a botched liposuction that is extended. And if she's lucky, in 3 sessions is possible to recover the greater part of the defects. It's possible even to treat more than 4 or 5 times, depending on the case. So some cases that is very difficult. You see, the first case I show you, sometimes when you have a big adherence from the deep tissue to the superficial tissue, is very hard to treat. Even with the fat, the people that use to do this kind of treatment knows that when you have a scar tissue, always you have to break the fiber fibrotic tissue, and you have to inject. And this is very hard, and this requires time, and especially with the fat, I've seen that it's very difficult to recover, because with the fat you have only one chance, or at least two chances to do. But with the hyaluronic acid, macromolecular one, you have a lot of chances, and you can do again. You can even obtain and have the good result you want.
Okay, thank you, Dr. Kavai. Okay, I have a question from Dr. Afarid from Egypt. What is the difference between IACORP MLF1 and MLF2, and which one do you recommend for each type of procedures? Okay,
I repeat that MLF1 and MLF2 are the differences in the width of the molecules. So does it mean that the biggest is the molecule, the more is recalling the water, so it's more is recovering the volume that got lost. I rather prefer to use MLF1 when I'm going to treat the superficial tissue. When I see that I am in front of a liposuction, superficial liposuction that has an even effect, that has a better result, and I have to recover the waves, the waves that has in the shows in superficial skin, I will use MLF1. When I see the big dimple, when I see the concavities that are very deep, and I want to give more volume, I will use MLF2.
Okay. Thank you very much, Doctor. We have different questions about potential allergical reactions. Is there any risk of allergy or infections after the treatment? Let's talk a little bit about the safety of IACORP's product.
Okay, on my experience, I didn't see any. Okay, if you use the right technique, and the most important is to use the right technique, of course, is to be enough sterile, not to inject. While you're injecting, you insert bacteria, so it's very important to clean properly and to have a good sterility of the skin. This is the main thing. So with this one, you avoid any kind of infection that can be is possible. Then it's important how to use it. First, it's important to use the cannula in the right way, in the right level, and not injecting too much. But I like to inject retrograde because I can control much better. And regarding the allergy, we are conducting, as I told before, a study. Is more than 1 year that we are conducting study on 100 patients, me and other 4 doctors. We saw that till now we didn't have any allergy coming from IACORP. Does it mean that the product is very safe and it doesn't give any allergy reactions?
Okay, thank you very much, Doctor. I have another question from Dr. Kang from Ireland. How long do you have to wait after the surgery to correct it with IACORP?
Okay, usually in the first period after the liposuction, it looks the patient is almost is happy because there is a swelling. When the swelling go down, does it mean after the 3rd month it starts showing the defects on the skin, the biggest defects, and the most of them appear after 6 months. Then this is the moment that is possible to start treating with the IACORP, start treating the defects and to start the treatment.
Okay, if you plan to do fat, that's a question from Dr. El Sawi. If you plan to do fat grafting for correction, how long will it stay at the injection site?
You mean, sorry, can you repeat? Because I don't understand if fat grafting after the...
For correction, for correction, yeah. How long will it stay?
The fat grafting, how long it stay? Okay, this,
yeah.
In the fat grafting can stay for the rest of your life. The problem of fat grafting, as I told you, is a reabsorption. Reabsorption that, especially in that area that are very fibrotic, is very fast, and it runs in a very fast way. And after 6-7 months, you can find sometimes the 40% of the fat injected. Regarding the injection of hyaluronic acid and fat, is not possible to inject both together. Because this is not correct. If you have done before fat grafting and then you faced a reabsorption, then you don't have any more fat and you want to inject hyaluronic acid, yes, it's possible. After, always I keep in mind that 6 months is the deadline, and I have to start to do every kind of treatment at least after 6 months.
Okay, thank you, doctor. Because I know that you use bioscience product IACorp for other treatments, we have a lot of questions about breast augmentation. Do you advise or do you recommend IACorp for that kind of procedure?
No, I'm not. We don't have any evidence that is working for the breast. It's not a procedure that is admitted in any society of plastic surgery and aesthetic and dermatology, because the breast is not has to be treated with fillers. Absolutely not.
Okay. Okay. We receive a question from Dr. Sirkin and others about that topic. Could you, if people is asking if we can talk about the quantity of BDDE that contains the MLF2, it's less than 0.001%, which means that we can call our products BDDE free. That's very important. In some case, another question from Dr. Alvarez. In some case, you have redness and swelling after the injection on site after 2 months. Do you have that kind of symptom after injecting, Dr. Prabai?
Sorry, I didn't got the last. I didn't get.
Okay, so a doctor said that after 2 months he had some cases of redness and swelling after the injection. What do you recommend in that case?
After hyaluronic acid, after IACorp.
Yeah.
Okay, this is maybe can be with just a topical cream is possible to treat. If you have something like that, you can, or topical cream with a cortisone cream, or if you see that is something that is more evident, you can treat with local antibiotic cream and like fusidin cream or gentalin beta. Or if you have something that is more heavy, you can give antibiotic. But this is the redness that happen because maybe it happens because it's not good the way it has been injected. Because if you spread in the right way, you do not create any lump, because you don't create any invasive treatment in the tissue. So the most important is not to achieve the result just in one way, but wait. Because I've seen sometimes they're asking me, because I'm following the product since a long time, they're asking me why it happened this and all this other problem. Maybe because you want to achieve the result in just in one way and injecting too much. The amount that I consider safe is a 50 cc every time in each area. So if I have to do a buttock, I inject 50 and 50, and then I wait a few weeks, and I see that the product is well accepted from the body, and then I undergo for another injection, because I heard someone that is injecting more than 10 syringes, that means 100 and 100 each side. In this case, you can create, of course, an inflammation. You can create it with every product, even if it doesn't have a BDDE. So it's the amount of product that create in any case the problem.
Okay, we got a couple of questions about the quantity of lidocaine do you inject. I think it was not so clear during the presentation. So how much quantity of lidocaine do you inject during the procedure?
Okay, I have to tell you this. In the past, I used to inject only the entry point. So when I mark the area, I mark a small circle while I'm going to insert the sharp needle, and then I will insert the cannula. In the past, I was used only this. Then there are some patients that are not feel comfortable, they feel pain. So I see that on my experience, if you inject all the area with the same cannula or with another cannula, same width of the cannula, I mean the 18, you inject in 10 square centimeter. 10 square centimeters. So does it mean that is a 5 centimeter per 2 centimeter? You inject 1 cc of lidocaine, not to create too much, swollen, and not to create too much liquid area. It's possible to be concentrated and to have less pain of the patient.
Okay, we have another interesting question from Roger Sirkin. He said, in my experience, Hyacorp seems to last longer than Macrolane did. He said he has injected Macrolane since the beginning of this product. Do you think the same? And if yes, what would be the explanation for that?
On Macrolane, I didn't have the experience so much because it has been removed from the market. I started using from 2016, 2016 I started using Hyacorp since the beginning. I've seen that the problem of the Macrolane was mainly the migration that Hyacorp has less. So this is why maybe it lasts more, because it stays more in the place where we inject.
Okay, thank you very much for that answer. We have another question from Eleni Theodorakopoulou about this correction for lipo. Also, can you use also hyaluronidase?
No, in the hyaluronidase, no, I don't use hyaluronidase. I use hyaluronidase only in cases I inject too much, but in these cases I don't use hyaluronidase. Not in my practice for these cases.
And I think it would be one of the last questions because people is asking for post-treatment procedures. Do you do the same post-injection precautions after a lipocorrection as in case of augmentation or lifting?
Can you repeat, because if I do the same, sorry.
The question is if you do the same post-injection, if you have the same post-injection precautions after lipocorrection as in case of augmentation or lifting.
Yeah, I do the same precaution. Yeah, same.
It's exactly the same.
Yeah.
Okay. Okay, thank you very, very much, Dr. Kribay. I think we answered all the questions we received, so that's fantastic. Thank you, all of you, for being here again, because we have a lot of attendees. Our next webinar will be about calves area with Hyacorp. It will take place on May the 14th. It will be held by Dr. Francesco Marchetti, probably at the same time as this one. So thank you very, very much for being here again, and we'll see you very soon. So stay tuned. Thank you very much.
Thank you.